Good evening. My name is Bisola Adeniran, and I'm one of the FMP students at United States University. And this week I will be conducting neurologic assessment on my patients, and I'll be going to my patient room now to introduce my patient. Hello, how are you?
I'm fine, how are you?
How are you? What is your name?
My name is Michael.
Your name is Michael, and how old are you, Michael?
I'm 18.
18. All right. So I'm going to be conducting a neurologic assessment on you this evening, and I just want you to know that this is being recorded. Did you give us consent to record this video?
Yes.
All right, thank you so much. And before I begin my assessment, I'm going to first wash my hands, okay? Okay, my hands are washed and clean, and now I'm actually assessing for cognition on my patient. My patient level of cognition is intact. His consciousness is normal. Is alert. Is awake. Is well groomed. Is coherent. Is able to speak to me clearly. He does not have any hoarseness in his voice as he speaks to me, and is able to sit up, is aware of his environment. So after this, I'm going to assess for my patient's mental status, and by that I'm going to ask him his date of birth, and I'm going to be cross-checking that with the information that I have. And what is your date of birth?
April 7th.
Okay. All right. So that is what we have in the system. And also we are going to also check what city were you born?
I was born in Chicago.
In Chicago. Awesome. What is today's date?
Today is April 13th.
Okay, awesome. Today is April 13th. As you can see, my patient is able to answer those questions correctly. And can you tell me who is the President of United States currently?
Joe Biden.
Okay, President Joe Biden. My patient also got that question correctly. So now I'm going to test for your speech, okay? And by testing for that, my patient is able to, verbalize. My patient is able to verbalize clear sentence, and that's how I'll be assessing that. So by now, I'm gonna give you a short sentence, and then you tell me, okay? Okay, I want to eat my breakfast by 8 a.m.
I want to eat my breakfast by 8 a.m.
As I test that, my patient is able to repeat that sentence clearly, and that is good. So next, I'm going to also assess for recent memory of my patient. Can you tell me what city were you born?
I was born in Chicago.
In Chicago?
Yes.
Awesome. Okay. And what day is today?
Today is April 13th.
Is today Monday, Tuesday, Wednesday? What day is today?
Today
okay.
is Tuesday.
Okay, awesome.
Oh, sorry, Wednesday.
Awesome. So, and what else? Yeah. So now I'm going to also ask for remote memory. And by doing that, I'm going to ask you, who was the first president of United States?
George Washington.
George Washington. Awesome. Correct. My patient is able to answer that question correctly. So now, next I will be checking for my patient's judgment, and by checking for my patient's judgment, I will ask you, I'm gonna give you a scenario. You were in a store and you saw a purse on the floor. When you saw the purse on the floor, what will you do? When you saw the purse, you saw the address of the owner in the purse. So, and you also have some contact information. What will you do?
I would either call the person or put it in their mailbox or...
Okay. Okay, awesome. That is a good thing to do. You can either call the person with the information that is in the purse so that they can pick it up and and then, or maybe you might drop it at the nearest police station. Maybe they might locate the owner and give it back to them. So that is a good judgment. And so now we are going to start with the cranial nerves assessment. And the first cranial nerves is olfactory, which is the smell. It has to deal with the smell. So I'm going to have my patient close his eyes, and I'll tell him to smell what I have in my hands. And if he's able to smell it, then we will know that the cranial nerve number 1 is intact. Okay? Can you smell this for me? Close one nostril. What do you smell?
Vanilla.
Vanilla, correct. Close the second nostril for me. What did you smell?
Cinnamon.
Smell it again.
Vanilla.
Vanilla, okay, good. And then now we're gonna smell this.
That's cinnamon.
Cinnamon, okay, good. The other one?
Cinnamon.
Cinnamon. So now I just finished checking the olfactory. Now we are moving to cranial nerve number 2, which has to deal with the vision, which is optic nerves. And with the optic nerve, I'm going to use the Snellen chart and otoscope to check my patient's eyes reaction to light, and also to check the retina, the sclera, to make sure there is no redness, there's no bulginess, there's no discharge. So I'm just gonna go ahead and assess with my otoscope right now. Okay. Okay. The optic disc is intact, and there's no redness, there's no bulginess. So now I'm gonna use the Snellen chart, and I'm gonna have my patient to read. I'm standing 6 feet away from my patient at this point, and cover one eye and read. Okay, cover your left eye and read this line for me.
E. P-T-Z-O.
Okay, cover the other eye. Okay.
E-P-T-Z-O.
Awesome. And my patient's vision is 20/20, which is normal. Awesome. So now we are going to move to cranial nerve number cover one eye for me before I move. Cover one eye. Okay. So I want you to look up, look down. Can you see what I have on the side?
Yes.
Okay, awesome. Cover the other eye for me. Can you see what I have on the side?
Yes.
Okay, can you see it moving up?
Yes.
Awesome. That's good. That's good. You can leave there. So now I'm going to go to cranial nerve number 3 and trochlear cranial nerve number 4. Number 3 is oculomotor and trochlear is number 4. So how I test for that, I think I'm checking 3 cranial nerves together, which I will be also checking the abducent, which is cranial nerve number 6 as well. So I'm doing 4, 5, and 6. Okay. So I'm going to check for the extraocular movement of your eyes, and by doing that, I will move this pen light into 6 different locations, and then I want you to gaze at this pen light, okay? Okay, good. Now we check for So now I'm gonna shine this pin light into your eyes to see how your eyes react to light. Okay. Okay, the pupil did constrict, which means it reacts to light, which is normal. So the next thing is cranial nerve number 5, which is trigeminal, and I'm gonna be checking for motor function and sensory function as well. So I want you to open your mouth and close your mouth. Okay, close it tight. Awesome. I'm gonna check for temporal mandibular joints of my patient. Okay, open your mouth against against resistance. Awesome. There's no cracking, there's no pain as my patient go through that assessment. So now I'm gonna go to facial cranial nerves. Oh, yeah. So what I'm gonna do before I move forward is the sensory part of the trigeminal nerves. So I'm gonna have my patient close his eyes now, and I'm going to use the cutting board. So I want my patient to tell me if he can feel the dullness or the sharp sensory, and also he's gonna be able to tell me what part of his face I've used this cutting board to touch.
Oh.
Is that on the right or left?
Right cheek, left cheek.
Okay.
Forehead, chin, ear, left ear, right ear.
Okay. So now the next one is facial nerves. So the facial nerves is cranial nerve number 7, and I'm gonna have my patient to close his eyes and then open your eyes. Make a smiling face for me. Make a frowning face. Pop your cheek out. Awesome. So that cranial nerve is intact. So the next one is cranial nerve number 8, which is acoustic cranial nerves. So we can also call it vestibulocochlear. And with that, I'm going to whisper some word into my patient's ear. I will close one ear. I will close one ear and whisper a word. Green, red. What did I say?
Green, red.
Okay, awesome.
Orange, pineapple.
So my patient is able to hear on both sides clearly, and which is normal for my patient. Now I'm going to go into Weber test, and which I'm going to strike the tuning fork and then put it on my patient's forehead, and I will ask him if he can hear on both sides clearly. Can you hear it?
Yes.
On both sides clearly?
Yes.
So there's no hearing loss. And the next one is a Rene test, which I'm gonna be testing for the Rene test. The Rene test will be to check for bone conduction and hair conduction. Can you still hear it? Tell me when you can no longer hear it.
I can no longer hear it.
Okay, but can you hear it now?
Yes.
Okay, tell me when you can no longer hear it.
I can no longer hear it.
Okay, so that shows I'm gonna do it also on the other side of my patients here. The bone conduction. Tell me when you can no longer hear it.
I can no longer hear it.
Can you still hear it?
Yes.
Tell me when you can no longer hear it.
I I can no longer
So
hear it.
that means that the hair conduction is greater than the bone conduction. Then my patient has no hearing loss. That is that. Now I'm going to glossopharyngeal, and that is cranial nerve number 9. And I will be checking for gag reflex of my patient. So can you before I do that, can you swallow for me? And swallow. Any swallows, any pain swallowing?
No.
Okay, swallow one more time. Okay, my patient is able to swallow without difficulties. And now I'm gonna check for gag reflex. Can you open your tongue for me? And at this time, I'm inspecting my patient's mouth, and I can see that it is moist. The uvula is at the midline, it's not bulgy, and open your mouth. Open your mouth. Open. Ah. Okay, now we're gonna check on the gag reflex. Open. Ah. Okay. So now we move to cranial nerve number 10, which is vagus. What I checked there is for my is function of the uvula, and also to be able to see if my patient can swallow, which my patient can swallow properly. So, and since we've been here, my patient has been speaking to me clearly, and I think my patient is speaking clearly, no hoarseness, and no difficulty swallowing. So now I will move to cranial nerve number 11, and I'm gonna put my hands on my patient's shoulder. And what you do is to try to, resist me, so I can see that you have the strength on your shoulder. Yes. So that cranial nerve is working and it is intact. So I need you to move your neck against resistance. Try to move it towards me. Okay, awesome. Move it towards me. Awesome. And that is good. It shows that cranial nerve is working as well. And cranial nerve number 12 will be the next cranial nerve that I'm checking for. So open your tongue, your mouth for me. So stick it out. Okay, so what I'm checking for there is to make sure that the tongue is at the midline, and there's no deviation noted during this assessment. So now I'm going to have you stand up now. I'm going to assess your gait. So I'm going to assess your gait. I want you to move back. No, move back. Okay, can you walk towards me? Walk towards me. Okay. Okay, so now I want my patient to walk on his toe. I'm going to try to adjust. No, come this way. I need to adjust the camera. So I'm going to have my patient walk on his toe. Walk on your toe. On his toe. Okay, awesome. And now I want you to do toe to heel. Do toe to heel like this. So I want you to do that on a straight line. So by my patient walking, what I'm doing there is checking for his gait, and his gait is balanced. So now I want you to walk on your heels. Okay? Awesome. My patient is able to walk on his heels, and the gait is balanced, and there's no abnormality, and my patient had already walked on his toes as well. Have a seat, and there's no abnormality. So now So now I'm gonna also assess for robot testing on my patient. And robot test, I want you to bring your arms out and close your eyes. So what I'm assessing for is to see if there's any jerking, if there's any weakness or any, drift. So I did not see none of that. So that means that is intact. You can put your arms down. So now I'm going to try to push your hands down, and I'm looking for drifts. So when I try to push your hands down, you resist me, okay? All right, awesome. And then I'm gonna push it up, resist me, okay, awesome. And then put your arms together, okay? I'm gonna try to pull it, okay, awesome. All right, okay. So now I want you to do a rapid alternative movement. In that test, I want you to sit down and alternate your arm open and close on your thigh. Close your eyes and do supination and pronation of your arm on your thigh, and do it as fast as possible. Go ahead. Okay, awesome. My patient is able to do that correctly. Now I'm going to hold this up. So you are going to point to this and then point to your nose, okay? And do it as fast as you can. Close your eyes. Okay, my patient is able to do that correctly. That is fine. So now I'm going to do sensational test, which I'm gonna have my patients close your eyes, and then wherever I touch, just tell me, okay? Tell me where you can feel my touch.
Right there.
Touch the place where I have touched. Okay, touch the place where I've touched. Okay. 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 So now I'm gonna do 2-point discrimination. So I'm gonna be using 2-point objects like paper clip, or for this case I'm gonna be using this sharp thing to do it. But the thing is, my patient should be able to know if it is 2 points or if it is 1. Okay, so that's the exam that we're about to do. So close your eyes for me. Do you feel 2 points or 1?
2.
2. Do you feel 1 or 2?
1.
Awesome. Do you feel 2?
2.
Do you feel 2 or 1?
2.
Okay. Do you feel 1?
1.
Do you feel 1?
1.
I'm doing it on both upper extremity and lower extremities. So do you feel 2?
2.
Awesome. Do you feel
1?
So the next one is stereognosis. And what I'm going to do is I'm going to put something in my patient hand, and I'm going to ask my patient to identify what I've put in his hands. Can you close your eyes? Okay, can you hold this for me and feel it and tell me what I've just put in your hands?
A pen.
Okay, good, correct. So I'm going to put one more on the other side of your arm. Can you tell me what is this?
Measuring tape.
Awesome. My patient got it correctly as well. So I'm going to do graph extension, and the graph extension is me writing a number on my patient's palm, and if he's able to tell me what is written on his palm, then that means that is intact as well. Close your eyes. What did I write?
Is that now?
M, correct. And then tell me, what did I write on your palm?
3.
Awesome. That nerves is intact as well. So now, I'm going to do a light sensation and dull sensation by using my cutting board on upper and lower extremities, okay? So you just tell me if you feel dull or if it is sharp, okay? Can you close your eyes for me? So, did you feel sharp or dull?
Dull.
Okay.
Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Sharp.
Okay. So the next one is a motor system, which I will be checking for the motor strength of the upper and the lower extremity of my patient. So I'll be checking for the bicep strength and tricep strength. So I'm going to be pulling aside, so try to resist me, okay? So I'll be doing abduction and I'll be doing adduction. Yeah, my patient is able to, and then I'm going to resist me from pulling your hands in. Awesome. Resist me from pulling your hands in. Awesome. And the strength is equal. Resist me from pulling your hands down. That is awesome. That is normal. So now I want you to resist. Okay, oh, good. And that is 5/5. Can you pull out? That's 5/5. Now I want you to pull your feet down. Okay, awesome. Okay, so I want you to make a fist, and don't let me break the fist apart, okay? Don't let me move the feet apart. Okay, good. So I want you to hold my hands, hold it, grip. Okay, okay, awesome. That's a strong grip right there. That is awesome. And that is 5/5 grip. So the next assessment that I will try to do the hip abductor, and so what I'll do is move your hips, okay? So you should be able to resist my movement, okay? Awesome. Do the same here. Awesome. And now I'm gonna try. Okay, great. That's 5/5. That's strong. That's the hip abduction. And now I'm gonna move to the reflexes, which I'm gonna be needing the reflex armor to perform this assessment. So first I'm gonna start from your upper extremity. So I'll start from your wrist area, which I'm going to be checking for the reflex in your wrist, which is called the brachioradialis reflex. Okay, good. The reflex is 2+. We can see it. Say awesome. The reflex is 2+ because we can see the thumb of the patient moved up. And I'm also going to be checking the biceps, and I'll be checking that by the brachial artery. Awesome. That's a 2+. That is 2+. And now I'll be checking the tricep. Okay, that is 2+. That is 2+. So I'm gonna test for the patella, which is by the kneecap area. So I'm gonna be hitting the hammer on your knee and to check for the reflex there. That is 2 plus. The patella is 2 plus. The patella is 2 plus on both sides, both right and left knee. So I'm gonna check for the Achilles. Achilles, I'm gonna have you lie down in bed, and the Achilles is at the back of my patient's ankle, and I'm going to hit the armor, reflex armor. Awesome. Awesome. The reflex is there. And also I'm going to check for it's going to be the plantar reflex. And also Babrisky reflex is another thing I'm checking. Also, when I use the tip of this hammer to find my patient's foot, I'm looking for the reflex to be plantar flexion and not fanning his toes. Okay, awesome. So the reflex is intact. All right. So you can get up. So now I want you to lie down. Now I'll be checking the abdominal reflex as well of my patient. Can you cover up, be under the blanket? Thank you. So I'm checking the abdominal reflex of my patient. I hope you can see that. I don't know if it's okay. I think it's recording. So I'm going to, okay, you can really see the reflex. It is positive. It is 2 plus. So I think we have come to the end of my neuro assessment on my patient for today, and I just want to thank you for allowing me to work with you today and to assess your body, and everything looks normal, and I will see you next time. Okay, thank you very much.